Welcome to another podcast in the American Hospital Association's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of AHA's Clinical Affairs and Workforce. And I'm joined today by Dr. Rebecca Schwartz, Associate Professor and Chief of Social Behavioral Sciences at the Department of Occupational Medicine and Epidemiology and Prevention, the Associate Investigator at the Feinstein Institutes for Medical Research, and Director of Research and Evaluation at the Center for Traumatic Stress, Resilience, and Recovery at Northwell Health. As well, I'm joined by Dr. Bellehsen, Director of Behavioral Health at the Center for Traumatic Stress, Resilience, and Recovery at Northwell, and the Mildred and Frank Feinberg Division of the Unified Behavioral Health Center for Military Veterans and their families. And today we're going to hear about that Center for Traumatic Stress, Resilience, and Recovery at Northwell, and the amazing work that these two physicians have put together for that team. So to get us started, Dr. Schwartz, let's start with you. Can you tell me a little bit about yourself, and then we'll go to you, Dr. Bellehsen, to hear a little bit about you and then a little bit about Northwell.
Sure, I'm happy to talk about that. Thank you again for having us today. My name is Rebecca Schwartz. I'm a psychologist by training, although I mostly function as a research psychologist. And I've been at Northwell for about 9 years now in the Department of Occupational Medicine, as you mentioned. My work has really largely focused at Northwell on research involving trauma and the impact of trauma on many different populations, including most recently work around different natural disasters in our area, Hurricane Sandy. I also did a lot of work in Houston regarding Hurricane Harvey, and I also work closely with the World Trade Center 9/11 Health Program for World Trade Center responders. And just to speak about Northwell more broadly, Northwell is a very large health system. It's, I think, the largest employer in New York State besides the government. There are 76,000 employees in Northwell. And we'll talk more about our center in a bit, but I think one of the wonderful things about Northwell is that we have a really strong, really dedicated, and really large employee workforce, healthcare workforce. And as we think about how this pandemic has impacted our healthcare workers and think about the size and scope of Northwell Health, it's important to think about all of the considerations that our center has had to, really think about in terms of how to provide support during this difficult time for this large health system. I also think that, we have, I think, about 23 hospitals. Mayor, correct me if I'm wrong with that one, associated with Northwell. And every hospital has a different culture. And it's across the board, though, it's a culture of support. And I think Northwell in general has shown a lot of support, particularly around our center, which we'll talk more about in a minute. I'll hand it over to Dr. Bellehsen to continue.
Well, thank you very much, Elisa, for having us here, and really pleased to be talking with all of you. So I am also a clinical psychologist, and I'm, as was mentioned, director for the Center for Traumatic Stress, Resilience, and Recovery, as well as another program serving veterans and their families. And both of these activities really reflect my longstanding interest in providing support to those impacted by trauma, traumatic stress, and our first responders in different capacities, both in the military as well as now among our healthcare workers. I've also been fortunate to be trained to provide consultation in various evidence-based therapies, including prolonged exposure, cognitive processing therapy, and have consulted for various programs, including the World Trade Center mental health program that's affiliated with Northwell, and been able to also oversee some research activities for PTSD, including transcendental meditation as a novel treatment for PTSD. So it's really been building on this work and this background with trauma, stress, and also resilience building that we were able to come to this program of developing a Center for Traumatic Stress, Resilience, and Recovery for Northwell Health, a fairly new program that was, recognized, as Dr. Schwartz indicated. The scope of the system is quite large, and Northwell was among the epicenter hospitals of the first surge. Both some of the particular hospitals, including LIJ and Medical Center in Queens, including LIJ Forest Hills, as well as some of the other sites that we were able to initially provide some support to, and then over time developed into the center, which I think speaks to, again, the supports really that Northwell has put forward. As such a large system, it recognizes the need to really prioritize taking care of our own in order to take care of our patients as well.
Absolutely. And so you started to touch on it, Mayor. So can I ask you to expand a little bit on what is the center, and sort of you talked a little bit about the impetus behind creating it, but I know it was a labor of a number of years and a labor of love, at least for the two of you.
Well, yes, and really the program, in some ways, we were fortunate that we were thinking about something like our center even before COVID came in. Dr. Schwartz and I collaborating on various trauma-related activities in our different areas. Dr. Schwartz was largely out of occupational medicine, which she could speak about more, and myself being in the behavioral health service line. We recognized the need to unify some of our activities related to trauma. So we were building this. It was going to start smaller, and our plan was to build it in open in July of 2020, and of course March of 2020 came along and COVID hit. And what happened was that there was recognized need for helping to organize and promote resilience and provide supports to our staff that were on the front lines. And so initially it was a voluntary effort that we helped to oversee among various behavioral health entities and providers across the system. And over time, as we developed, it became a funded, organized structure to really help to oversee resilience, trauma services, as well as evaluative and research activities. But perhaps most uniquely was that in order to really inform our response, we have been collaborating very, very closely with our corporate partners in HR, EAP, other entities. That too started out of an emergency operations center that was stood up for COVID, where we were doing our work, but has become really an enduring aspect of our structure.
Rebecca, what would you add about what you have seen as you've brought this center together, and sort of some of the driving factors for you in creating this work?
So, just to echo what Dr. Bellehsen was saying, we really saw the need for a comprehensive system approach to addressing trauma and in different capacities. And that was, we saw that, before COVID, but COVID really brought it to the forefront. From a research perspective and an evaluation perspective, I also see the need to really be able to assess for trauma and trauma symptoms across the health system, and to also think about innovative designs and research for addressing what we see and research capacity as well. And I think that the collaboration or the synergy between the clinical work and the resilience building that Dr. Bellehsen was talking about and the research and evaluation component makes for a really comprehensive center. And it was something that, again, we were envisioning even prior to COVID, but maybe starting smaller, and now we're really scaling it up. And one of the programs actually that we'll be talking more about that is an integral part of our resilience building as part of our center, CTSRR, is the Stress First Aid program that we are in the process of launching across the health system. And even Stress First Aid was something that we were thinking about bringing to our health system to support our healthcare workers. It's a peer support model. We'll talk more about it. But we were thinking about it before COVID, because healthcare workers just, by the nature of their jobs, are experiencing occupational stressors on a regular basis, and high levels of acuity in particular settings within the hospital as well. And we were working with our colleagues at Zucker Hillside Hospital, which is the psychiatric campus of Northwell Health, to bring Stress First Aid to them prior to COVID. So it was just a natural fit when we saw how useful this sort of framework would be for thinking about supporting healthcare workers and helping them to support each other once COVID hit, to really bring it to everybody.
Absolutely. And Mayor, you touched on this a little bit, but you really sort of through your incident command started to bring together this work. But how did you not only bring them together, but keep together all of these different groups across a very broad system to be able to support this work?
Well, I think we've been very fortunate that the system has been I would say blessed, but also cultivating, really great leaders and leadership and a culture that recognizes the need to work in teams and to break down the silos and to rather than necessarily have particular activities be the domain of one entity or department, organize for projects in ways that really allow for breaking across the silos and working as teams across departments. So, we are both at a very, structural manner funded in part through HR, and so therefore have a certain degree of, inbuilt interface with HR, including both our EAP and employee wellness programs, as well as also our employee engagement programs there. And so to maintain that over time, we have ongoing meetings, ongoing processes to continue the work. For example, our assessment, our well-being assessment, is something that is a joint venture of HR with CTSRR. And then we have opportunities for regular collaboration with all of these partners, EAP, wellness, chaplaincy, and or even forming what we're going to call a care team, which is going to be a next iteration of some of the work that we're doing. So in addition to that, because of our placement within behavioral health and being a large system, we're able to also then tap into the behavioral health partners that we have across the system. And we maintain some regular opportunities and structures for input, advice from these different entities, and then the integration also in collaboration with occupational medicine, where Dr. Schwartz sits and has a natural, of course, relationship with thinking about occupational stress and the work that they're doing.
Dr. Schwartz, let me ask you, since research and measuring outcomes and evaluation is what you do, how are you measuring the outcomes and evaluating the success of this program? And I'd love to hear a little bit about what you're hearing from team members' experience from your perspective, and then Dr. Bellehsen also from yours.
Sure. I'm happy to address that. So we do have a pretty comprehensive evaluation structure in place, both to really look at our center and the center's activities, as well as the individual activities and processes that are coming out of the center. So, for example, for overall CTSRR process and outcome measures, we're really on a regular basis collecting data through a HIPAA compliant, red cap server from all of our providers on their resilience coaching activities, their group resilience activities, any sort of work that they're doing. It could also be presentations, didactic sessions. So we're collecting all of that data in terms of how many we're doing, how many people we're reaching at those sessions. And then we're also collecting satisfaction surveys and surveys around increased knowledge or increased self-efficacy, maybe that are coming out of some of the more didactic, the didactic activities. We're using a measurement-based outcomes system really for assessing our direct clinical services that our psychologists are providing as part of the center to our employees and also to some degree to community members as well. So we're collecting measures, at a baseline time point and then regularly over time to see if, the treatments are working and to see if symptoms are decreasing. But then similarly for stress first aid, for example, we have a large system in place to look at that, to look at how many people are we reaching. We have, that involves a series of trainings, for example. So we want to see if the trainings are effective in increasing knowledge around the stress first aid program and also increasing self-efficacy around being able to provide additional training to team members around stress first aid. It's really a train the trainer type model. And then we also are collecting outcomes over time. So among an entire hospital, for example, we do a baseline survey and then we follow up at 3, 6, and 9 months to see if we're able to see a culture shift, to see if we see resilience improving, if we see, sense of support from the organization improving, sense of self-efficacy around being able to cope with stressors, and resilience, improving. And then ultimately, we're using a framework that comes out of the National Academies of Science and Medicine to really look at how that impacts sort of proximal and distal outcomes. Does stress really decrease? And do we see workplace turnover decrease, for example? Do we see unplanned absence decrease? Do we really see some of these workplace indicators change over time? As we stagger our rollout of stress first aid, do we see differences in the hospitals where stress first aid is being implemented, as compared to one where it has not yet been implemented, for example? And in addition, Dr. Bellehsen mentioned before, we partnered with Human Resources to launch an annual well-being survey. And I have to say that Northwell, I think, was at the forefront of really sending out a system-wide survey to everybody, all 76,000 of us, that asked questions around well-being, around mental health. And there was some anxiety, there was some stress around launching it, that maybe there'd be pushback, and what if this causes people to experience stress or sadness around answering these questions. And the research shows that that's not the case, and that in order to change the culture around being okay to discuss and to acknowledge these feelings that are pretty pervasive, particularly right now, we need to ask the questions, and we need to really be okay asking those questions. And then what we're doing is using the data from that well-being survey to really target our resilience-based programming and our efforts around stress first aid and other programs as well. So we're really using data in a lot of ways to sort of drive the initiative and then to evaluate it over time.
That's great. Dr. Bellehsen, what are you hearing more anecdotally from your team members about their experience in this work as you're moving forward?
Their experience with our work has been, thankfully mostly positive from what we're hearing, particularly with response to the stress first aid activities. In general, of course, what we're hearing as far as the experience of team members has been, high levels of stress, not surprising, similar to across the country. We actually, one of the tools we use based on within the stress first aid model is a way to think about stress on a scale of 1 to 4 with color coding, and 4 being the highest. And we do see that about a third of our population is in the higher stress zones, and that's not atypical really with what we're seeing in the general population of healthcare workers as well. And the stressors are many. COVID has presented a onslaught of different stressors over time, from dealing initially with the pandemic to just the direct dealing with COVID, to the secondary effects, the staffing shortages, vaccine mandates, et cetera, that have been rolling through over time. When employees engage with us, they're very appreciative of the fact that this service is there. It offers validation to their experience, to recognize, to be seen in terms of the difficulties of what they've been going through. And some of the programs in particular, are already making an impact in terms of this culture change that we're trying to achieve. As I mentioned, that tool brings stress into the domain of talking about colors, which is a little less stigmatizing. And in our pilot site, everybody's using the language already. They're talking if they're in a green, yellow, orange, or red. They're using that as a way to report out on how units are doing and how teams are doing. And they're using it also in creative ways that go beyond the program that we've set out, which is what we'd love to really see, is that they're building it into things that they call SFA Fun Day, for example, where they dedicate a day to having fun. And they're also using it to inform when critical incidents happen, which is ideally what it's there for, to be able to link together. We have also, I should have mentioned, we have a very robust Team Lavender at Northwell. And so they are able to provide some immediate on-site first response to critical incidents. And then thinking about also the SFA language and thinking about this collaborative of different resources available, our leaders are at the unit levels are then able to also engage and activate some of the other resources in a more coordinated way. But this is still early. This sort of our pilot site that I'm reporting out on. But as we've started to scale, which we're in the process of doing, we're seeing some of the same effects as well.
That's amazing. I mean, usually you say, culture change takes 3 to 5 years, and you guys are bringing that down to 3 to 5 months. It sounds like that's wonderful. So let's talk a little bit about what some of the challenges are and challenges you faced getting it off the ground. And then as you started to scale it, and Dr. Bellehsen, you started to mention your the scaling efforts now. What are some of the challenges you've run into that you've had to mitigate?
Thank you. Yes. So, it's still, rolling, and I'm anticipating many more challenges to be coming. I mean, just getting off the ground, we've had to deal with just all of the startup challenges that you can envision, right? Getting buy-in, getting funding, getting people to believe in the vision, aligning people on the vision. That in itself has been quite the effort over time. I mean, we were thinking about the program, but in a small way prior to COVID, and then trying to bring it to scale, or even to the system as something to endorse, required a lot of, I think, advocacy, a lot of education on how this could be helpful. And following that, and I would say even combined with some of the the real utility of the evaluative efforts in Dr. Schwartz's work, it helped to really justify and make the need and the cause clear. There's still challenges in terms of aligning different entities. Even though we are able to work across teams, there are different domains. There's always the politics of that as well, but it's been something that we've been pleasantly able to do. As we are thinking about scaling, it's really about growing in a way that you can effectively meet the needs while not overstraining ourselves. Pacing, I think, has been an important part throughout. Like, there was an impulse and need almost at the beginning, given the severity and the urgency of everything, to try to do something for everyone, which we have made offerings for everyone. But to do this program for Stress First Aid appropriately, we also had to be thoughtful and strategic. So, that's something that we continue to develop on staff, develop the staff for that. And staffing in general is challenging, I think, at this time, as we hear for all our healthcare workers, and it includes behavioral health. It's been hard to find the right staff that have the skills and can meet this, and it is a challenging environment for that.
And Dr. Schwartz, around the evaluation piece and the outcomes, what are some of the challenges you faced?
So as I mentioned earlier, just even sometimes asking the questions was making people, a bit worried, but we were able to really overcome that hurdle. And then I guess it's just really around engagement and response rates and survey completion, and trying to really incentivize people just out of the goodness of their hearts, because it's not like we have incentives to provide, monetary or any kind like that for people to complete the surveys, but just really trying to explain how important it is to the sustainability of our program, to CTSRR and Stress First Aid and all of the other programs within CTSRR, for us to get that feedback so that we know, if it's working, and how well it's working, and are we reaching the people we need to reach, and all of those important questions. So we don't want to also cause stress by asking people to complete a whole lot of surveys. So we're trying to really keep it to a minimum where we can. And really, be targeted and thoughtful about that too, because we don't want to impose any, stress from the survey itself, or fatigue around, survey completion.
Well, and I think you've already mentioned you've done the one, absolutely right thing is, if you ask the question, do something with the data.
Yes.
And that's great to hear. So as we wrap up the podcast piece, I'd love to hear from each of you advice you would share with others who called you up and said, listen, our health system needs something like this. What would you do first? And how would I go about this? So Dr. Bellehsen, let's start with you.
Sure, thank you. Before I also go on to that, I also want to add, in terms of overcoming the obstacles with regards to your last question, which I think is also speaks to the advice piece as well. One of the really critical factors, I think, that also allowed us to be successful was a combination of kind of bottom up work around seeding some of these ideas, seeding some of these thoughts, having a large cadre of champions and supporters in different settings, in behavioral health and others, while also really engaging with the top-down leadership. So, we had, strong support through these efforts that came at the system level in terms of not only the corporate support, but also support from nursing. Institute for Nursing is a program, is a center within Northwell that has been very engaged in large scale implementation projects for Northwell, and they've been major champions and partners for us in designing and adapting what we want to do in a way that works for Northwell. And so having partners like that within medicine as well have been really tremendous for us. And so I think, what I would say is canvassing, understanding, of course, the local system that you're involved in, the resources that are available, and developing a strategic vision that works and can align with your system. Everyone can be structured a little bit differently, and we have our programs in different ways for EAP, Lavender, Team Lavender, chaplaincy, etc. That we were able to bring them together to work collaboratively with CTSRR. But taking that mindset to really identify your champions and where you can align and ally, I think that will pay dividends.
Dr. Schwartz, your advice.
Yeah, I firmly agree with everything Dr. Bellehsen just said, but I would also add that it's important to think big and not just pigeonhole into a specific, area with a specific traumatic experience. So, for example, right now, a lot of the work that we're doing is really around supporting the healthcare workers through this pandemic. But I know from my work, and Dr. Bellehsen certainly knows from a lot of his work with the veterans, there's a reason to have a systematic and structured way to address trauma that in many different forms. And even this resilience model will extend to be a preventive model over time, because although this pandemic does seem like it's going on for a long time, and it's unusual in that sense, the work I've done around natural disasters, even 9/11, in some ways, maybe it's even more analogous to wartime. Those other instances are really circumscribed in terms of time, but I do think it's important to think big and to think, how can we support our healthcare workers, our community members for the long haul, not just around this particular traumatic experience. And how can we provide culture change and tools to help further that culture change so that it can be used in many, many different instances? Because we were saying earlier, healthcare work just by definition and by its own nature is, stressful. So it's really thinking in sort of a bigger picture way so that we can, continue this work long after COVID is hopefully something of the past.
Couldn't agree more. I remember one of the very first lectures I ever heard with people talking about well-being. Physicians stood up and said, well, medicine is inherently a traumatic profession. And I think you're realizing that and realizing that we have to have preventive support in place for the team. So thank you so much for sharing a little bit about your program. And I encourage everyone to look for more information about the work on the AHA's website, aha.org. Thank you for joining me.